Why am I still rounded with a firm, poochy belly after DIEP flap surgery despite losing weight, not having a lot of internal fat? So I'm going to discuss the etiology of abdominal bulging following DIEP flap dissection for breast reconstruction, what it is, how it can be fixed, and go from there. So I'm Dr. Dumestre, board certified plastic surgeon. So when you're getting a DIEP flap for your breast reconstruction, it's basically like a same person transplant where that big piece of tissue is being transferred to the chest, coming with an artery and a vein. Now, that artery and vein comes from underneath your ab muscles and then sends little feeding branches to that abdominal tissue. Back in the day, this used to be a completely non-muscle sparing approach, meaning the entire ab muscle was taken to preserve that blood flow. In that case, you always had problems with abdominal weakness. We've since gotten a lot better at the harvest techniques, and what happens is now I just split the muscle fibers, carefully find the artery and vein that are feeding that piece of tissue, and then transfer it up to the chest. Now, what happens is, depending on your anatomy and surgical technique, you may still have some muscle damage that results in weakness to your abdominal wall after the DIEP flap, and that is what leads to bulging. So, two different things. Say you have your ab muscle, you've got the artery and vein that travel underneath it, and then it sends one big juicy vessel to feed that piece of tissue. In that case, it's completely muscle sparing. I'm always very meticulous with the technique, make sure to preserve all of the motor nerves to the muscle, and you should have absolutely no weakness. Now, say in order to supply circulation to that whole thing, instead of one big juicy vessel, you've got 3 tiny little twigs, and they're all separated by a piece of muscle. In that case, even with meticulous surgical techniques, I'm still going to have to take a strip of muscle. Depending on where that strip is taken, it could leave you with some abdominal weakness. So what happens then is, when you think of a side view of your abdomen, even if you have very little inner content, so you don't have much fat inside, you're otherwise healthy, thin, your ab muscle here, that rectus muscle, has lost its strength, and that's usually what keeps everything in, what keeps everything flat. So once it's lost its strength, this pooches out, your abdominal contents have more strength, and they are constantly pushing, and that's when people describe feeling really, really firm at the base of their belly, and it's directly because of weakness. There's nothing you can do exercise-wise to correct it. This is in contrast if you have a lot of visceral fat, so I can tell that your muscles are working well, you don't have very much fat on the outside, but your abdomen is full of your organs, the fatty tissue around them, and so physically there's just not room to push everything in to give you that flat contour. So how do we fix abdominal bulging? Now, the first test for it is in the office. I have you lay flat, I put your feet together, and I ask you to do a straight leg raise. With that, I can often see a physical midline bulge where everything pooches out and then goes back in and is nice and soft when you lower your legs. So first, determine that it is the bulging, and then what do I do during the surgery? So I have to go in, expose your abdominal wall, go to the area behind your rectus muscles, your ab muscles, and put a piece of mesh. So that is a piece of strong support that gives extra strength to you behind those weakened muscles. This is not an intra-abdominal surgery, meaning I'm not looking at your organs. I'm going in between your ab muscles and your fine layer of abdominal wall. Then I over tighten the fascia, so the casing that's on top of your muscles that gives you that strength. I really tighten that up so that you have extra strength and support. And with that, it can correct the bulging. You certainly can have some recurrence, but I've had a lot of success fixing that bulging for patients that way. Super frustrating problem, often misdiagnosed or underdiagnosed, and leaves patients such as this one feeling very defeated with their abdominal contour despite doing everything they can to re-strengthen and rehabilitate after this type of surgery. Let me know if there's any clarification needed for this. I understand it's a little bit of a confusing topic. Have a great day.